Welcome to 101nursing.com. My name is Priscilla, and today we'll be talking about sinus tachycardia. What is sinus tachy? It's a heart rate that is elevated above 60 to 100 beats. So anything above 100 is tachycardia. How do you know it's tachycardia? When the strip reads this EKG strip. So, is there a P wave with every QRS? I'm looking and I see a P wave with every QRS. Is there a QRS? Yes, I see QRS. Is it regular? Yes, it's regular. Regular is, how do you determine it's regular? You put two lines between every QRS and see that it's frequently timed, frequently in the same little line for every single QRS line. So QRS couple. So 1, 2, you put a line between this line and that line, and then you go and you measure it from 1 and 3, or 2 and 3, 3 and 4, 4 and 5, 5 and 6, and it's gonna be the same. It's gonna be regular. So irregular beats is when one is occurring here and one is occurring right here, and then one is occurring extremely wide or extremely narrow. That's an irregular beat. Is the PRI interval normal? So the P wave you see here, is this interval normal? And that's 12 to 20. And I'm going to blow this up a little bit more if I can. And yes, it looks like it's 1, 2, 3 boxes, and that is 12, and that's perfectly normal. It's just making it. Is a QRS interval normal? 1, 3. So the QRS interval is normal because it is 12 as well. 12 boxes. Each box is equivalent to 0.04. So you just add plus or times by 2 times by 3, and then you will get your box interval. And is there a normal rate? No, the rate is not normal. The rate is above 100. Let's count the rate. 1, 2, 3, 4, 5, 9, 10, 12. So about 1200. Not 1200, 120 beats per minute. What causes sinus tachy? Exercise is one of the primary causes of sinus tachy. Someone that is in immense pain, you'll see that tachycardia, they have tachycardia, as well as an increased blood pressure rate. Heart failure, fever, hypovolemia, drug use, or a drug that helps them keep their heart rate up. And what can you see? Signs and symptoms. You'll see angina, dizziness, palpitation. They'll feel it. They'll feel weak. They'll have syncope, which is basically passing out. Syncope. Passing out. Shortness of breath. And for sinus tachy, it can be a plethora of things that can cause sinus tachycardia. What we want to do is we want to make sure that they treat the borderline cause. And that's if it's exercise, decrease exercise, you'll get back to normal. If it's an MI, treat the MI. Ischemia, treat the ischemia. Whatever it is, treat the borderline, the line cause. Thank you very much.